right, good morning, good afternoon, good evening, depending on where in the world you may be joining us from. Thanks so much for being here. We are excited to spend some time today to talk about student health, including immunization and insurance requirements. Okay, so we have just such a wealth of folks joining us in this room. My name is Grace Fuller. I serve as the Manager of International Experience and Engagement from the International Services and Engagement Office, and I'm joined by some wonderful colleagues who all allow to introduce themselves. So I'll hand it over to you, Jessica.
Hello, everyone. Thank you so much for joining us today. My name is Jessica Boyle. My preferred pronouns are she, her, hers, and I'm an International Student Advisor in the International Services and Engagement Office, ISEO. Welcome.
My name is Jill Batika, and I'm the Billing and Insurance Manager from Student Health here on campus. And I'll be going over the health insurance requirements for you this morning.
Good morning, everybody. My name is Annie Horton. I'm the Director of Nursing from Student Health Services, and I'll be going through all of the incoming health requirements with you today.
All right, so a little bit of a snapshot of how we'll spend our time together. We do have some reminders from our office as well as undergraduate admissions that you can use as kind of a first steps checklist. So as soon as you accept that offer of admission, there are some things that you'll need to do. Then we'll hand it over to our wonderful colleagues in Student Health Services. As like they said, they talk a little bit more in depth about some insurance as well as immunization requirements. And then we'll have some last reminders before we head into our open question and answer. So please do note that we have a time dedicated at the end of today's session for open question and answer. We ask that maybe you pause on any questions to see if those questions will be answered during the content of today's presentation. But do know that you're open to submit those questions at any time. And with that, how you'll do so. And so you are in listen only mode, which means you can hear us, but unfortunately we can't hear you. So the main way that we will interact today is through the question and answer feature on your Zoom menu bar. In a minute here, we'll see what that looks like. But if for any reason should a future question arise, you can always reach our office at icontact.ucsd.edu. And finally, we are recording. So you will be able to view this webinar recording as well as others at inewstudentwebinars.ucsd.edu. We ask, usually it's about a week of turnaround time before the webinar is posted on our website, but this is also the very same place that you can register for future webinars. Okay, so like I said, that's kind of the Q&A feature on your Zoom menu bar. You can submit questions at any time, but we will have a time dedicated at the end of today's session for open question and answer. So some first steps. First off, we just want to congratulate you on just being admitted to UC San Diego. It is very competitive and it's a huge accomplishment. So truly a heartfelt and warm congratulations. We are so excited to welcome our new cohort of Tritons. A few steps that we just want to highlight. So sometimes students in their excitement are like, yes, I'm coming. The way we know that you are coming is by logging into your applicant portal and accepting that offer of admission. That really activates a few key next steps that you'll be sure to need. It'll activate some steps that you'll need to use for future checklists. And then additionally, completing the California residency for tuition purposes questionnaire. So I know many of you have questions about, what tuition might look like depending on your residency status. And so that will answer a lot of those questions. So when you accept your offer of admission, 2 to 3 days later, you will receive an email asking you to create your Triton Link Active Directory and Duo accounts. This is sometimes also referred to as your single sign-on. This is really important because the creation of your Active Directory will provide you with your UC San Diego PID or personal identification number, as well as email. And you will be asked for your PID and your UCSD email throughout your time here to log into many different portals and many different accounts. So these are two really critical pieces of information. So again, accepting your offer admission is kind of what starts this process. Then creating your single sign-on with your Active Directory and Duo accounts, which will provide you with your PID and email. Now, using this PID and email, you can begin to request your visa documents. So if you go to inewstudent.ucsd.edu, it will take you to what you see here on the left is our homepage, our landing page. You'll click, many of you, on undergraduate students, and then it will take you to what you see on your right, and where we've broken it down into 3 steps to kind of guide you through the process of requesting some of your visa documents, and then finally preparing and then arriving at UC San Diego. So we've designed this to hopefully get you the information you need when you need it. But this is a great resource that you can always refer back to should any future questions arise. The only other thing I'll say here is that while we've designed this to be a resource, we have had 2 previous webinars that have really gone more in depth about requesting some of these documents and then actually applying for your US student visa. So if you go to inewstudentwebinars.ucsd.edu, our first 2 webinars for undergraduate students does go into more detail about this process. And with that, I will hand it over to my colleague Jill to talk a little bit more about health insurance.
Today, again, my name is Jill Batika, and I'm the insurance and billing manager over at Student Health on campus. And today I'm going to tell you about the health insurance requirements and the services that we offer here on campus at our student health clinic. First, the agenda, I want to go over the health insurance requirements with you for the University of California, what we provide at the Student Health and Wellbeing Clinic on campus. We'll go over the Student Health Insurance Plan. We refer to it as SHIP. The benefits of the SHIP, our health fee waiver process. If you have insurance already, we're going to tell you how to avoid paying that SHIP fee by filing a health fee waiver. Our reduced access fee for TRITONS, we refer to that as RAFT. And then we'll answer any questions that you have, and I'll give you resources if we don't get through all of those questions today. So for starters, this is a picture of our student health clinic here on campus. We're centrally located right on Library Walk, and that's right down from the renowned Geisel Library and across from the Price Center food eateries. So we're very easy to find. And walk-ins are welcome, but we do encourage appointments. You can schedule through My Student Chart. This is a picture of all of our QR codes that will help you and give you resources that you might need if you do have any questions about your healthcare, your billing, or a waiver. Tap into any of those QR codes to find out more information. It'll take you right to our website. This is a picture of the UC Jacobs Medical Center, which is housed across the Interstate 5 freeway from us, where they house just about 300 specialists for hair, and it is an acute hospital. Our student health clinic is on campus, but we do partner with our health system here in La Jolla. And Grace is dropping in URLs that will be helpful for you as well in the chat box. So why SHIP? For SHIP participants, the student health clinic is going to be your primary care physician office. So if you're sick or you don't feel good, we're going to take care of you. And it's all dependent on who your payer is. So as a requirement, a non-academic requirement of your registration here on campus at the University of California, all students must have health insurance that's comprehensive, that covers you for outpatient and inpatient care. And in order to make sure that everyone is covered, the University of California Office of the President mandates this charge on your student registration. You can avoid paying it by filing a timely health fee waiver, but we want to make sure that you're safe and you can get through your educational journey in the best way possible without a lot of medical financial burden. So we offer this student health insurance plan. It's a comprehensive insurance plan through Anthem Blue Cross. And it offers medical, pharmacy, mental health, dental, vision. And if you do have any kind of chronic illness, you'll want to contact us before arriving here, and we'll help you transfer any care that you might need. We also can prescribe drugs and administer them here, and we have a full laboratory and x-ray available. You can visit any of the University of California clinics throughout the state of California and access the same benefits. And if you are traveling globally, this plan does cover you at a 60% reimbursement rate. For this school year, you'll see a charge on your student account for $898 for undergraduates per quarter. That's 3 times. That'll cover you fall, winter, and spring. And the spring includes the summertime. So it's a full year's worth of coverage, but you are paying it on a quarterly basis. And if you look at it on an annualized basis, you would be paying just about $224 per month to have this really good plan. So please keep that in mind and take a look at your benefits and see how they match up against what we offer here. And again, for the SHIP participants, the Student Health Clinic is now your primary care physician office. That means if you don't feel good, you wake up with pink eye or something that you know you need to have checked out, you'll want to come over to the Student Health Clinic, and we have doctors, nurses, nurse practitioners that can take care of you and give you an initial evaluation so you can find out what's going on and get a prescription that you might need or a referral to the next level of medical care. We have a payer classification of student health insurance, or your fee for service and you pay by credit card and you get reimbursement back from your insurance company, or you're on a raft and that will pay for as many scheduled appointments as you like, lab services or x-rays with no additional charge. It is not an insurance, but it's peace of mind for those students that have outside insurance and don't want to go out into the community to access your care. And we'll talk more about that in a couple of slides. The student health hours, we're here Monday, Tuesday, Wednesday, Thursday, and Friday. Mondays, we're open from 8 to 6 p.m., a little bit later. Tuesday, Wednesday, and Friday, we're here 8 to 4 p.m. And on Thursdays, we open a little bit later. We are here all year round, fall, winter, spring, and summer. You can make appointments by contacting us by telephone, or you can log into my student chart and make an appointment for your services, either primary care, lab, our nurse clinic, or with one of our dietitians or social workers. So we want to go over some of the benefits of the student health insurance plan so you know what to compare with your health insurance, or if you're out there trying to buy a plan. So we have 3 tiers of coverage, and under these 3 tiers of coverage, every single student that enlists in the SHIP program gets these benefits, but we try to incentivize you to utilize the University of California providers. We have a beautiful health system that has care available to you within walking distance or a shuttle right away. For those UC providers, if you see one of our student health clinic providers and they say that you need to go see a specialist of some sort, like an allergist or a surgeon or a rheumatologist, they'll write you a referral and you will contact the providers over at the UC health system. And that's a $10 copay to see them in evaluation. If you are hospitalized or you have a surgery or a scheduled procedure, those services are covered at 90%, leaving you with 10% of the bill. There is no deductible, and a deductible is what is paid first before the insurance kicks in. So under the UC tier of benefits, there is no deductible that you have to worry about. If you decide that you want to use an Anthem Blue Cross provider, that's not a UC provider. It's someone that is in the community that's contracted with the insurance company directly. Your copay for an evaluation would be a $30 copay. And then if you have a procedure or you're hospitalized at a non-UC facility, it's covered at 80% after a $500 deductible is met. So you pay the first $500 of the bill, and then the insurance will pay 80% thereafter, but you still have a 20% commitment. The third tier of those benefits is out of network, and we highly discourage this because there is a $1,000 deductible under this particular tier of benefits. Out of network means that the provider that you're going to see is not contracted with Anthem Blue Cross, and they're not a UC provider. They generally don't hold contracts with insurance companies, so they expect you to pay up front and then seek reimbursement back from the insurance plan. But again, there is a $1,000 deductible that comes into place, so you pay the first $1,000 of the bills, and then it's covered at 60% thereafter, but leaving you with 40% co-insurance. And we will certainly help you if you have any questions and you get a referral and you want to know who you should go see, what's the most cost effective. We're always going to let you know that UC is the most cost effective, but we'll break it down for you depending on who you want to go see. Under this plan, we partner with our counseling and psychological services here on campus. So we refer to them as CAPS. If you do need to see a mental health or behavioral health provider, please contact CAPS at the phone number given. It doesn't matter if you have the SHIP or not. Every student is entitled to access these benefits. If you need a referral, you can certainly call CAPS, or you can contact Student Health and we'll write you a referral to see a provider out in the community, a psychologist or a psychiatrist. And you can schedule these appointments through My Student Chart. If you go see a UCSD college mental health provider, it's a $5 copay to see them each time you do. If you go see an Anthem Blue Cross provider for mental health, it's a $10 copay. Our referrals are generally written on a 52 visit basis and they're good for 1 year. So you can continue treatment or therapy as you need to without worrying about getting that bill. We also have Live Health Online, which is a therapy that can be done over the phone or through video visit. And there is no copay. We do have a coupon on our website that you can access, and that will be free. For emergency room care or urgent care would be if you need to have someone, if you need to be seen right away, but you can't wait until the next day, you can schedule an appointment with the UCSD urgent care that we have via La Jolla Drive is where they're located, and that's very close to the campus. You can go through My Student Chart and schedule your appointment, and you can also see wait times there. You can also access our after hours nurse line if you do need direction or advice. Again, our phone number is 858-534-3300. And again, any payer, depending on if you keep the SHIP or not, you can contact that phone line and a registered nurse will direct you if you need to wait until the next day to access care at our clinic, if you need to go be seen at an urgent care, or if they think you need to immediately be seen at an emergency room. And just so you have an idea, emergency rooms are reserved for those services that are urgent, usually unexpected situations that happen. You've either been hurt or you're sick and you didn't expect this to happen and you feel that you need immediate care. Then you would go over to the emergency room. There is a there's a $150 copay, and those services, if you are admitted, are covered at 90%. This is a picture of our emergency room offerings and the urgent care. And again, those are within walking distance or a shuttle ride or a bus ride away from the campus. Under this plan, a prior referral, a doctor has to write a referral for you before you go access care at a specialty clinic or have any procedures done. The exception to the referral rule would be for emergency room, urgent care, dental or vision. Dental or vision, they're both direct access and you can contact them immediately to access care. You don't need a referral, but for emergency room or urgent care, no referral is required because it's an urgent situation. But for care that's routine or that you have been recommended by one of our physicians, you're going to need a referral so that the insurance will pay their portion of the claim. You can contact us at the phone numbers provided to get a referral before you go, because we will not give you a retroactive referral or backdate the referral. Under the student health insurance plan, we also offer Delta Dental. They are a dental provider network here in California. You contact them, give them your zip code, and they'll give you a list of the dentists that are participating under the plan within the community. You have to go off campus for this care, but they will give you $1,000 worth of curative services or a tooth cleaning and x-rays. Teeth cleaning and x-rays are covered in full. If you have a filling for a cavity, or you need a root canal and a crown, or you need any kind of curative services, then those services would be covered up to $1,000. Anything that exceeds that, you're going to have to pay out of pocket. And again, you can contact the Delta Dental Network at their 800 number or go on their website to find providers that are within the community. 95% of the dentists in California are contracted with Delta Dental. And again, a referral is not necessary for this care. Under the plan, you do receive some vision benefits. You receive 1 routine eye exam per benefit year, and they will give you $120 to apply towards frames and lenses or contact lenses once per benefit year. We have an optometry suite in the student health clinic right here on campus. We have optometrists that can do eye exams, and we also sell glasses and also contact lenses. So you can come right here and have your services rendered, and they'll bill them to the insurance company, and there is a $10 copay. If you want to go off campus, you can contact Anthem iMed, and they'll give you a list, again, of providers that you can access in the community, and no referral is required. For those of you that are not going to be part of the student health insurance plan and you want to avoid paying that $898 charge on your student account, there are timeframes that you have to apply for the health fee waiver, and that's found on the Triton link where you would log into your student account and you would file an application for a health fee waiver. The waiver timeframes are from May 6, 2024 to September 14th. We'll open that waiver up again on the 15th and keep it open till the 20th, and that's your last chance to file a waiver prior to the fall. And you just need a copy of your insurance card and a summary of your benefits. To achieve that, if you don't have a card or a summary of benefits, you would contact your insurance company and they can provide you with that. There's also tips and tricks on our website, so please tap into that QR code provided and you can find out information about the waiver criteria and what you must have in place in order to waive the insurance requirement. As part of the waiver process, there is a question at the end and they'll ask you if you want to be part of our raft offering. And I'm going to talk about that in just a minute. If you are an international student, under the waiver process, we do mandate that you have to have medical repatriation and evacuation coverage under your plan. So please keep that in mind. This is a picture of your Triton link where you would log into the health fee waiver. Click on that link right under financial tools and it'll take you to your single sign-on. And then it'll ask you to fill out some information. It'll take about 5 minutes to fill out the application. It's going to ask you the name of your insurance company, their phone number, who you're insured under, what your subscriber ID number is. And they'll ask you to upload a copy of your insurance card front and back. And that's what that information is on the right-hand side of the screen. That's an insurance card, and also that summary of benefits is right next to it. If you don't have that, that's okay, but you will need a copy of your insurance card to file that waiver. This is the only way that we accept the waiver, so you do have to do it electronically through the Triton link during the open time frames. And again, that's May 6th through September 14th, and up until the 20th for the late period. As I said, that last question on the health fee waiver application is going to ask you, do you want to pick up a raft? And it's just a radio button. You can pick yes or no. And there's also a link that will tell you what's covered under the raft. Again, this is not an insurance. It's just a concierge membership to come into the student health clinic. And those students that waive successfully, it's a very good thing to think about keeping or taking a raft, because you probably will be living on campus or nearby. And if you wake up sick, you don't want to go and navigate the streets out in La Jolla. You want to come right to the student health clinic. So if you do pick up a raft, it's $70 per quarter, and it allows you unlimited scheduled appointments in the clinic to see a provider, lab services, and skeletal x-rays. So you generally, if you don't pick up a raft and you want to come into the student health clinic, an evaluation with a doctor can run from $89 to $159. And then there are added fees for lab services and x-rays and prescriptions. So if you do have your own insurance, we're going to see you. If you need to pick up a prescription, we're going to send that prescription to a pharmacy that's covered under your insurance company. You can go pick that up and that would be covered under your insurance, and you don't owe anything because you've already paid that $70 prepayment as part of your registration. For specialty care or hospitalized services, you're going to use your own insurance. We will help you if you have any questions, if you want to contact us, but you'll want to contact your insurance company to find out where you should access care. The RAF does not cover pharmacy services. As I said, we'll send a prescription to your pharmacy, and it doesn't cover dental, optometry, vaccinations, or services obtained outside the student health clinic. This is a good feature for parents that are sending their students away. RAF is more of a peace of mind for students so that they know they can get up and come right to the student health clinic without any issues or having to pay any additional dollars to be evaluated. As an international student, I just want to let you know that we don't accept international health insurance. So the insurance that you want to pick up, if you're trying to buy insurance, we have some online offerings that are accepted through the waiver process. You want to tap into those URLs that are provided there to see if this is something that meets your health requirements. But if you want to waive the insurance, these are 3 plans that I can tell you will go through the waiver process without any issue. If you're relatively well, then this is probably a good idea because this is far less expensive than the student health insurance plan. But if you do have a chronic ailment, or you need to see a doctor pretty frequently, or you have mental health services that you want to obtain, then you'll want to stay on the SHIP because it is a comprehensive plan and covers all of those things. The plans that I have provided here for you are reimbursement plans, and you'll have to pay upfront and then seek reimbursement. But on a monthly basis, they are cheaper than the SHIP insurance. Some reminders for you, something to think about now is, do I want to keep the school health insurance or do I want to get my own plan? On May 6th, we will open that waiver process on the Triton link, and that'll be open until September 14th, and that's the deadline for routine waiver filing. September 20th is the hard deadline. We can't accept any health fee waivers after that point. And if you do file a health fee waiver between September 15th to the 20th, there is a $50 late fee that's attached to your account. No waivers will be accepted after the date of September 20th. And then September 21st is when you officially start the fall quarter. And that's when the UCSHIP becomes effective if you do keep the health insurance through the school. Some of the resources that I'd like to provide for you. I'm going to give you a contact list of all of the insurance companies. So Anthem, Blue Cross, Delta Dental, Optum is for the prescriptions. Our UCSD health billing, if you have any services over at our health system, you can contact them with any questions. Academic Health Plans is our brokerage that we run our enrollment through the insurance for. And the financial clearance department at UCSD is where you can find out how much it might cost you to have a service. If you are a student and you obtain government coverage through the state of California, the San Diego Medi-Cal office is there for you. And then for our clinic, our URL is there, as well as our phone number for the counseling and psychological services, our student health insurance URL, and our phone number and email. We don't see students in person in our clinic, but we'll do a Zoom consultation with you, or you can join our Zooms that are offered on Monday, Wednesday, and Friday, and the login ID is there for you. We'll be glad to answer any of your questions, and I certainly recommend that you tap into our websites so you can see what we offer and who our providers are, where they come from, what their hobbies are. If they have a subspecialty like dermatology or women's health, you can find all of that out at our website. I thank you for your time this morning. I hope I answered some of your questions. We do record our webinars that we offer throughout the summer on our website, and you can certainly tap into those or attend one of our webinars. All of that information can be found on our website. And again, if you have any questions, please email us or give us a call. We're here all summer long. And also we're on social media. Check us out on Instagram or Facebook. Our health promotions department runs the post, and they do offer lots of insightful information. And if you are planning a career in healthcare, you'll want to take a look at that because there are some offerings for you as well. So thank you for your time this morning, and I hope to see you on campus. And I'm going to get to the Q&A box where I can answer some of your questions.
Hello, everybody. I'm going to go through our incoming health requirements with you to hopefully make this process a little smoother. So why the University of California has health requirements is that over the years we've seen outbreaks of various vaccine preventable diseases on campuses throughout the US. So the University of California, in conjunction with the California Public Health Department, implemented a set of requirements to help reduce this, so that students coming onto campus have good level of immunity. So that protection is for yourself, for your classmates, for your roommates, and we just really want to protect the overall University of California community. The health requirements currently, as they stand, are the first one is on tuberculosis. So we have students, everybody does a risk screening questionnaire, and risk is determined by that questionnaire. So if you are at low risk, the questionnaire will be all that's required. If you are at higher risk, you will also need to provide testing for us. Most students coming from outside of the US will be required to provide testing. Many countries have TB that is endemic, and so we want to make sure that you're safe coming onto campus. Our second requirement is regular immunizations, which includes Tdap, which is tetanus, and pertussis, and the pertussis is whooping cough, and that's really the component from this vaccine that we're wanting you to have protection from. MMR, which is measles, mumps, and rubella. Varicella, which is chickenpox, meningococcal for students 22 years and under. And then our last requirement is the COVID vaccine, which is a newer requirement that sits independently and is prone to a lot of change, given that this vaccine and this illness throughout the world has undergone many iterations. And so we roll with those changes, and the University of California responds to those as needed. The deadline for all requirements is July 10th. Academic holds are placed on varying dates, and the first one is the tuberculosis screening. So you need to have really prioritize our tuberculosis screening first. In terms of starting this process, you will need to have, as Grace talked about a little earlier, you will need to have your UCSD student AD login, which is your email and your password, which you are provided with in a period of time after you accept a position at the university. With that, once we have loaded all students into our electronic health record, which for us is called EPIC, and there is a student-facing aspect to that where you can see all of your health records, and you can do this whole process there. It is called My Student Chart. So it is an app on your phone, or it is a desktop version, and you can access it in all sorts of ways. But to access that, you will need to have that UCSD email and password set up. We load all students into our system on May 1st. So after this webinar, if you go looking there, you won't be able to access it just yet. But we load all students on May 1st, and by May 6th, all of the appropriate updates have occurred. So if you're still having trouble just after May 1st, just leave it until the following Monday, when all the academic information will be in there, which drives all of the requirements that you're going to need. You won't be able to see requirements until that time. Information regarding all of this is also in your Triton checklist. And this is what the Triton checklist looks like. It states all of the requirements again, how to access my student chart, where to go within my student chart, deadlines, website links, so you can trust that you can always find everything that I've talked about here in your Triton checklist. And then that's the COVID-19. So once you do gain access to my student chart, this is what it will look like when you land on the front page. Everything can be accessed through the menu. So once you go to menu, you scroll down to immunizations and screening. And in there is where you will find everything, with the one exception being COVID-19, which is housed in its own space. And so it is just further down the menu. And then once you access the immunization and screening tab in that menu, this is what you will land on. You will land on TB and immunization history. Now, once you go in there, you'll be able to answer the questionnaire for the TB. If it asks you to provide testing, you will find our form on our website. You will take that to your provider, and then there will be a little upload button. With the immunization history screening, you will gather all your vaccine records or use our form, which is also on our website. You will be able to enter all of the dates in the boxes and then upload that form there. And all of that comes through to the nursing team for review. And when you go in to add your information for your immunizations, you will get more information if you hover over the little information bubbles. So it'll tell you exactly the parameters that will make you compliant. So for example, with MMR, the first dose has to be on or after your first birthday, and there needs to be at least 28 days between dose 1 and dose 2. So you can get more information if you're wondering why you weren't compliant. That is where you will find it, as well as being on our form. So for TB, as I said, you complete that questionnaire, and if you're prompted to provide testing would be done at a hospital, a clinic, with your doctor's office, anywhere where you are able to access healthcare within your countries. We accept TB skin tests, which is a little bubble of tuberculin that is placed in under the skin, or the IGRA blood test, which, depending on where in the world you are, is called a quantiferon or a T-spot. It also depends on which lab that your particular healthcare provider is using, but that is a gold standard and a wonderfully accurate test. If you come from a country where you received the TB BCG vaccine as a child, and to know this, you would have a little indentation in the upper part of your arm. If you can access an IGRA blood test, that would be the preferred method of testing. If you can't, it's okay to do the skin test. Just know that sometimes that skin test may come back as a false positive due to the vaccination. A chest x-ray is also acceptable if you cannot find these tests, or your tests are positive, and then you need to go on to chest x-ray to show us that you don't in fact have active TB. If you have a positive blood test or a positive skin test, it could be that you have something called latent TB, which is an inactive form of TB in the bloodstream, which can convert to actual active TB. And we will, if that is you, we will advise you on how to get treatment for that when you come to school. It won't prevent you from enrolling or progressing in your admission process, but we do want you to get treated for that when you come. When you upload all of the tests, the form and your chest x-ray, which we do need to see the actual report, not the films, but the report that the radiologist provides for you. One of the nurses in my team, which are all registered nurses, will be reviewing those results. They will contact you if they need any additional information or that you are required to do more testing. So it is very important, once you have submitted your requirements, that you return back to my student chart to check for messaging. When you set up my student chart, make sure you put on active alerts so that you get a text message or an email to tell you when we've sent you a message. We have many students that come to school or receive academic holds because they didn't know that they needed to do something additional. In addition to that, if there are abnormalities or concerns with your TB testing or your chest X-ray, the process that it takes to actually move through the next stage of testing can take some time. So I would really urge you to get onto this process early to avoid any delays or to avoid those academic holds from being placed. We really, really want you to do this as soon as you possibly can once you are loaded into our system. And the deadline is July 10. Academic holds for tuberculosis are placed at the end of July. And you would see a hold in WebReg, and it will prevent you from enrolling in classes for fall, which fill up very quick. So is a very big incentive to get this process underway. Our next requirement is our immunization, and you will need to obtain your vaccine records. You can find these in your schools, in your healthcare clinics, and electronic records that you may already have. Many students find it worthwhile taking our form to their healthcare provider, and they will assist you in filling that form out and signing it. And if there are gaps, your healthcare providers can help by providing you with missing vaccines, because requirements for the US and the University of California and California may be different from the countries that you are coming from. So just to bear that one in mind. So you may need more vaccination. Alternative to vaccination for measles, mumps, rubella, and varicella is chickenpox, you can actually obtain a blood test which will show if you have immunity or not. So if you had chickenpox as a child, and many people do, then that blood test will show that you have immunity, so that you don't need to get additional vaccines. But you will need to upload that testing when you submit your when you submit this paperwork, and the system will prompt you to upload that if you put in that you had a positive titer, and a positive titer tells us that you have immunity. And then we can mark you for compliant for that particular vaccine. And again, our deadline is set at July 10, but holds not placed until November 1. And why we have that, we want you to get this process started. And if you are missing vaccines that you can't obtain in your country for whatever reason, you can actually choose to get them on campus or in the US when you come. For example, Tdap vaccine is often not available in other countries. So you'll be able to obtain that when you come to the US or come to school. A big advantage to having UCSHIP, the student health insurance plan that Jill was talking about, is that all of these vaccines and all of this testing would be free of charge and readily available in our nurses clinic here. And we run mass vaccine clinics right throughout the year, so people can come in very quickly and get those Tdap vaccines and other vaccines, all other vaccines actually. And also the advantage with RAFT, if you choose to opt out but choose to do our reduced access fee for TRITONS, is that the titers you'll be able to get from our lab, any additional quantiferon or TB testing you'll be able to get. And then we can advise you, and you would need to get the vaccines outside of student health. But it's a huge advantage to have RAFT if you are thinking of opting out of SHIP. But SHIP itself is wonderful in terms of vaccines, amongst other things, but particularly vaccines. So the COVID-19 vaccine, as I said, this is a changing process. So the US has moved to the COVID-19 vaccine being a seasonal or annual vaccine of just a single dose of one of the FDA approved vaccines, which includes Pfizer, Moderna, or Novavax. We received a new vaccine in September of 2023, which is the most updated version. So this is very similar now to how influenza is required on campus. So it's not required necessarily before you come, especially if you can't access it, but it will be required during the full quarter. And we are anticipating on the FDA releasing a newly updated COVID-19 vaccine in September, October of the coming fall. Many of you will have received prior vaccines, and there is space within my student chart to add all those doses in, which is super helpful for us to see your vaccine history. If you haven't had the most updated vaccine, if you're coming from outside of the country, then you can get it here in the fall, or you can choose to get the September 2023 vaccine. That is fine. You can get a medical exemption for any of our vaccines if you have had an allergy or you have a medical condition that states you shouldn't be receiving vaccines. There is a medical exemption form on our website. You can decline the COVID vaccine and the influenza vaccine for strongly held personal beliefs, which used to also include religious beliefs, which this now encompasses strongly held beliefs / religious beliefs. So you can opt out of the COVID vaccine and the influenza vaccine for that reason. On our incoming immunization form, right at the bottom of the first page is a box if you do choose to opt out. Of course, we would prefer that you don't. We do have folk at all times with COVID-19 on campus, so having the most updated protection from this illness is a real advantage for just life in general, but particularly for campus life. And as I said, all of these vaccines, Pfizer and Moderna, not Novavax, but are available all year round in our nurses clinic. And also a very convenient place to receive vaccines is in retail pharmacies in the US, particularly if you have an outside insurance. They can run your insurance type, and you can often get vaccines by a pharmacist in the US. And importantly, how you access help. The best place to access help is through My Student Chart, and there is a little message button called Ask a Nurse, and that is staffed not 24 hours a day, but very long hours and through weekends and public holidays. So the nursing team are responding to questions all of the time through there, and are happy to assist you. If you forgot to upload something, that's another place you can choose to upload your form to, and we will do our very best to turn that around within 24 hours. So the nursing team is here in the clinic Monday through Friday through sort of US business hours, but then we have nurses picking up these queries after hours and into the evening, and also on the weekends. So you can rest assured you will get a response usually within a day. Our student health website, which will be updated with all the current forms. So there have been a few changes from last year, so I wouldn't recommend using last year's forms. Just wait until May 1st, and all of the new forms will be there, as well as any new content related to updates. Just ignore the graduate division website. That is for grads only, but for undergrads, all of that information can be found in your Triton checklist. Yes, and just one big takeaway is just start on this process as soon as you can. And this is the team that will be assisting with this process. They are mostly all registered nurses and some medical assistants that have specialised training. I will be running webinars through the month of June, and so where lots of individual questions will be answered there, and we will do a bit of a live walkthrough of what My Student Chart looks like. All of you will have access by that time, and so we will be sending out emails from Student Health, so keep an eye out for those on those dates, and you can sign up for our webinars. And a webinar is always recorded and uploaded onto our website in addition to that. So thank you so much for joining us today.
All right, thank you, thank you. So I just have a few last slides before we get into our open question and answer. So there are already some ways that you can get engaged with your Triton community here. If you go to ievents.ucsd.edu, that will take you to our iEvents calendar. And this is a live calendar that's populated by our office, other offices on campus, as well as student orgs for all events that feature global engagement or our international community. Additionally, iPrograms are reoccurring programs throughout the year that offer engagement opportunities for our community. So if you'd like to learn more about them, my colleague Jessica is putting those URLs in the chat, and you can get a glimpse into some of our signature programs. And then finally, GAP. So the Global Ambassador Program is a summer-long peer mentorship program where we match incoming international graduate students with current UC San Diego undergraduate students. So this is a great resource. Many of our students have really loved participating in GAP. And they say that it was hugely impactful in their transition to UC San Diego. And finally, we are active on social media. So we are on LinkedIn, Facebook, Instagram, and YouTube. Many of our students choose to follow us on Instagram specifically, where we are at istudents.ucsd.edu. So some final reminders, there are some things that you can start doing now. So one is requesting your Form I-20 or DS 2019 via the iPortal. So to go there, you would go to iportal.ucsd.edu, but again, referencing iNewStudent for those instructions. You can also start applying for on-campus housing. So we had a webinar earlier this week on Tuesday focusing on housing options for our students. You can expect that webinar to be up on our website probably next week, but that is a process that you can begin exploring. Mid-May is when on-campus housing contracts are due, and like Andy said, July 10th is the deadline to submit all health insurance immunization requirements. We do strongly recommend that starting these processes early is in your best interest, so that way you have time should any issues arise. And finally, in September is when we get to meet many of you in person. So we're very excited. That's when move-in and check-in and a lot of your orientations, including your college orientation, as well as international orientation. And finally, we do have some additional webinars coming up. So on May 2nd, we're going to talk about finances and student accounts. So for example, how to pay your tuition and fees. On May 3rd, we're going to talk about SEVIS and the transfer process. So if you're already in the US, how to transfer your SEVIS record to UC San Diego. On May 7th, we'll talk about student life and getting involved. And on May 9th, we'll talk about campus safety. So as a reminder, these webinar recordings are posted at iNewStudentWebinars.ucsd.edu in about a week's time, but that is also the place where you can sign up for future webinars. Okay, so that includes our content for today. We are going to allow a few minutes for some open question and answer. So I'll hand it over to my co-presenters. If there's anything that has come through the Q&A that you think would be worth verbally highlighting for the benefit of the group.
I just had one question in the Q&A, and it was about shadowing healthcare professionals. So we do that on occasion, but you want to contact our main line at 858-534-3300, and one of the staff members will assist you.
So should any questions arise, if my colleagues would like to put any like relevant information or contact information rather in the chat, we can go ahead and do that should future questions arise. But we do have some questions that are coming through. So this is probably good to reiterate. So these are, our first question is, my student chart is not accessible. I tried to log in with AD credentials, no account existed. So maybe some, reminders around those timelines.
Yeah, so all of our new students, all of you will be loaded in May 1st, and all of the appropriate updates will have occurred by May 6th. So all of the academic information will be loaded in around May 3rd. So yeah, until that's the case, you won't see any of the incoming health requirements. So you just hold off for a few moments.
Yes, we want to get a lot of this information to you early so that you know what to expect and know how to go through this process, even if that's a little bit earlier than when you can access some of these systems. So in early May, you're going to have access to a lot of this, and then you can even go back to this webinar and kind of refer to it as you're going through the process. Okay, so we have another question that's come into the chat of when students can move into campus housing. So that is actually determined by oftentimes your college, residence life, and housing, dining, and hospitality, otherwise referred to as HDH. And so that's going to vary slightly depending on where you're living. But I really strongly recommend watching our housing webinar. Again, we had that earlier this week on Tuesday, and you can expect to see that on our website early next week. So I do student webinars at ucsd.edu will be a great resource for you, and it goes into much more detail around this question. All right, so please know, if any questions arise in the future, you can also always reach out to icontact@ucsd.edu, even if we're not necessarily the right office to answer that specific question. We do work really closely with our colleagues across campus, and we will connect you with the office that is. So thank you so much for joining us today. Special thanks to my colleagues who are here with us as well, sharing just a wealth of knowledge and expertise. And we hope you have a great rest of your day. Thank you.
Thank you.
Thank you.